For my disease presentation, I've chosen the topic of leukemia. I'm going to provide a brief overview of what that is generally, and then I'm going to focus in on chronic myelogenous leukemia for the rest of the presentation. So, leukemia is a cancer of the blood and early blood-forming tissues. In our body, all of our blood cells start as hematopoietic stem cells, as you can see in the picture on the right, and those are found in the bone marrow. So when those mature, they're either going to become lymphoid cells or myeloid cells, and that's going to have to do with the type of leukemia you have, depending on the type of cell affected. And it's mainly white blood cells that are affected, and we're going to go over the types that exist. So the different classifications are going to be acute or chronic. Acute leukemias are going to have cells that are dividing rapidly, and therefore the disease is going to be progressing quickly without any intervention. So someone who has an acute leukemia is going to feel sick within weeks of the cells being present in their body. And it is also, acute leukemias are the most common form of pediatric cancer. Chronic leukemias, on the other hand, have features of mature and immature cells. So because of this, they're kind of functioning at a lower rate, but nonetheless still functioning. So that causes the disease to progress more slowly. And therefore, someone may not even notice symptoms for months or even years, kind of depending on the severity of the disease. And chronic leukemias are going to be more commonly seen in adults. And then we talked about the myelogenous versus lymphocytic. So that's going to be the type of cell that's affected. And there are four major types. So there's acute lymphocytic leukemia, chronic lymphocytic leukemia, acute myelogenous leukemia, and chronic myelogenous leukemia. So we are going to be focusing on chronic myelogenous leukemia, or CML. It can also be called chronic myeloid leukemia, but we're going to just call it CML for the rest of the presentation. As I said, it's most common in adults, makes up about 15% of new leukemia cases, and it's slightly more common in men than women, and the average age of diagnosis is 64 years old. So currently has 3 known risk factors. The first one is going to be radiation exposure, and we're talking high doses of radiation. Also, age is a factor. The older you get, the higher your risk is going to be of contracting CML. And as I said before, it's more common in males slightly, and we aren't sure why yet. CML is caused by a mutation that happens during cell division, and a translocation occurs between chromosomes 9 and 22. So part of those chromosomes get swapped. This leads to chromosome 22 being shorter than normal, and when it's that short version, it's called the Philadelphia chromosome, and that's what's going to be present in most CML patients. The Philadelphia chromosome produces the BCR-ABL gene, which then goes on to produce the BCR-ABL protein, which is a tyrosine kinase, and that specifically is what causes the CML cells to grow and divide out of control. So here's a little visual. You can see on the left is the normal chromosomes. They break off and switch. Then the chromosome 22 becomes that short Philadelphia chromosome with the BCR-ABL gene. So signs and symptoms of the disease are going to be weakness, fatigue, night sweats, weight loss, fever, bone pain, which is going to be caused by the leukemia cells spreading from the marrow cavity to the surface of the bone, enlarged spleen, which can be felt as a mass under the left side of the rib cage, and feeling full after only eating a small amount of food. So a lot of these symptoms are going to be from the issues on the right. So anemia is going to be a shortage of red blood cells, leukopenia and neutropenia are a shortage of white blood cells, and then thrombocytopenia is a shortage of platelets. So the platelets causes issues with bruising and bleeding. Some patients may experience severe nosebleeds or bleeding gums. And then anemia is a shortage of the red blood cells, so that's going to prevent oxygen from getting to your certain tissues and organs, and that is what's going to lead to fatigue and weakness, and can also lead to shortness of breath. And then the white blood cell shortages are just going to cause immune problems. So testing for CML, usually people don't go in thinking like, oh, I have chronic myelogenous leukemia. Usually the first sign is going to be blood work that is a little bit off. So you could either have a high white blood cell count or a low red blood cell or platelet count. That would be usually the first signal that something's wrong. And then a doctor can look at your blood under a microscope and be able to see if there's immature or abnormal cells. And if they do suspect that you have leukemia, they're going to order a bone marrow aspiration and biopsy, where they take a sample of your bone marrow from your pelvic bone. And genetic tests will also be done to look for the Philadelphia chromosome or the BCR-ABL gene. So here's an illustration of what the blood cells may look like under the microscope. Obviously, it's not a real picture, but you can see on the right, the leukemia cells are taking up a bunch of room in the blood, so there's way less red blood cells than compared to the picture on the left. And then here is a more realistic picture of what you would see under the microscope. You've got the pretty uniformly sized red blood cells on the left, and then on the right, it's like different colors, different sizes. Those are going to be those leukemia cells that are just dividing rapidly and taking up the space of the normally functioning cells. So the treatment for CML is going to depend on which phase of the disease you're in. The least severe is going to be the chronic phase, followed by the accelerated phase, and then blast crisis is going to be the most extreme phase. A tyrosine kinase inhibitor, or TKI, will typically be the first treatment that the patient receives in the chronic phase, and this dosage can be increased if needed, or if the desired result isn't being produced, they can try a different one. There are about like 5 or 6 on the market. If the patient is in an accelerated or blast phase and the TKI isn't working, they may need chemotherapy or a stem cell transplant, depending on if they have a donor and if they're a good candidate for that. And there is a mutation to the mutation that's possible. So the T315I mutation takes place in certain CML patients, and that can cause some or all TKIs to be ineffective. So there's only 2 TKIs that could possibly be effective, and it's also possible that neither of those could work, in which case the people with that mutation may need to either seek out a clinical trial, try chemotherapy, or get a transplant. So here's a little picture of the gene, the BCR-ABL gene. Imatinib on the right over here is going to be the TKI that binds to the ATP site. So ATP cannot bind to the gene, and the cancer protein can't get energy to make more CML cells. So that's how that works. And this is just a little flow chart of the different interventions that can be taken when someone has CML. So the first is going to be the imatinib over here, which is the TKI that's most popular in CML treatment. You can increase the dose if that doesn't work. Check if you have that T315I mutation if necessary. There could be clinical trials for that. And then if nothing else is working, you could try chemotherapy or a stem cell transplant. So prevention, there isn't one known way to prevent most cases of CML. The best that we know of right now is to reduce exposure to radiation. So post-treatment options are that most CML patients will stay on their TKI indefinitely. Doctors are definitely going to want to still do follow-up exams and tests to make sure that the leukemia cells don't go back to growing at their original rate that they were. And it's also important to make sure that you have emotional support and are taking care of your mental health, because the stress of going through something like a cancer diagnosis is going to take a huge toll on you as well. So just a couple questions for everyone. Which chromosomes are mutated in CML? A, 8 and 20, B, 3 and 14, C, 9 and 22, or D, no chromosomes are mutated? And the answer is going to be C, chromosomes number 9 and 22 are the ones that are mutated in CML. What is the first line of treatment for a CML patient? Is it A, chemotherapy, B, tyrosine kinase inhibitor, C, stem cell transplant, or D, 5-day juice cleanse? It is B, the tyrosine kinase inhibitor. And true or false? limiting radiation exposure is the only known prevention for CML. And that's going to be true. So thank you so much, and I hope you have a great day.